Hello, everyone. You're very welcome to our Leadership webinar series. My name is Patricia White, and I'm a Project Officer with the EAPC, and we're delighted to have you here at the NursEduPal IMPACT webinar series on moral ethical leadership. We're also joined by the team of presenters and by my colleague Guillermo from the EAPC. So thank you. The webinar will start soon. We have a lot of people joining in, as usual, from all over the world. So we're just giving people a moment to get settled. And again, as always, you can translate in Teams. You can translate the slides into different languages, and you can also increase the size of your screen to make it more accessible. The webinar is being recorded and it's going to be available on our website, the NursEduPal IMPACT website, in the coming weeks. And this is a resource that will be available, freely accessible to all, along with the slides. As an attendee, we can't see you and we can't hear you, but we would really like to engage with you, and we'd really like you to engage with the webinar. So we want you to use the chat function. And as we ask each week, we'd like you to just put something into the chat, maybe perhaps we want to ask where you are in the world, where you're joining us from, or perhaps, what your profession is, just for you to find the chat button and to be comfortable using it, because we'd like to engage with you during the webinar. A certificate of attendance will be available for anyone who joins us. And at the end of the webinar, I will post a link to the page where you can complete the webinar evaluation form and you can download the certificate. And again, I think we've people already from all over Europe joining us. All that's left is for me to hand over to Mina Hukka, who will be chairing today's webinar, and that we're delighted to be joined by Ulla from Sweden. And I'm going to hand you now to Mina, and you can take the chair. Thank you very much.
Thank you very much, Patricia. I'm very delighted to have Ulla really physically here in Finland and sitting here with me. So I'm very delighted of this issue. So usually everything is nowadays online. So I'm always very pleased to have a real person sitting here. So I will introduce Ulla, and then we can start our webinar with our star. Ulla is our star today. So Ulla Nappa, she's a registered nurse from Sweden, and she has a specialization in oncology and also in palliative care. She has been working as a nurse with palliative care for more than 15 years in specialized home care. Before that, she worked for several years in surgical ward, and she was taking care of patients with cancer who had undergone surgery or were treated with chemotherapy. Some of the patients died at the ward, or some of them could go home to receive palliative care and die at their homes. And some of them ended with their lives, they lived their lives at nursing homes. 11 years ago, Ulla presented her thesis about palliative chemotherapy in late phases of life. In the last 10 years, she has been working as a senior lecturer in Mid-Sweden University. Her fields of teaching are palliative care, oncology, and scientific theory, and thesis writing from ground level to doctoral students. She have not written here it in the introduction, but she's also a docent. So congratulations for that. I'm very happy to congratulate you for this thing too. So I will hand now the floor for Ulla, and feel free to put in chat if you have any questions. I will follow these during the webinar, and I will then give them to Ulla if you want to ask something for her. So feel free and start.
Thank you. Thank you, Mina, for a nice presentation, and thank you to all of you who have come to this webinar to listen to me talking about ethical standards. I will share a presentation with you, and therefore it will take a little time before I have made this sharing. So just wait a little. So now I hope you can see my slides. Welcome to this third module of ethical standards in communication. This lecture will focus on communication in different ways. Your focus should be how to create your own ethical standards. And don't be afraid to write questions in the chat, as Patricia told you to. Minna and I will take care of them and give you the answers if we can. And then the photos in this presentation are either pictures of me or were taken by me. I have permission from all persons depicted in the photographs to use them in this presentation. So, what is communication? I think the most of you would say it is talking. Yes, you're right, but it is also other ways to tell people what you want. Communication can be a twinkle with the eye or a cough, and so on. So today's theme is communication from an ethical perspective. We must be mindful and be aware of the ethical dimensions in communication. That will help us to establish an own standard, focusing on ethical values like care, honor, integrity, and truth. After this lecture, I hope you become more aware of how your communication affects others involved in the communication process. I hope you are able to create a personal ethical standard for your communication. I hope you have improved your knowledge about communication principles. And I hope you are able to use tools when you are communicating in palliative care. To be a professional nurse, you need to develop your personal ethical standards. We know that communication skills are one of the most essential requirements of a nurse. Research has found that patients and relatives think that it is one of the most important aspects of care. However, the quality of care depends on approaching the patient and relatives individually. You need to identify their own unique needs, expectations, and goals. So, if you develop and use good communication skills, you will more likely deliver effective and person-centered care to this vulnerable group of patients and relatives. In other words, communication ethics is the foundation of good patient care. To create these personal ethical standards includes self-awareness. Self-awareness is a significant tool in the nurse-patient relationship, and it is a crucial factor in forming therapeutic relationships. Self-awareness is the knowledge of self and the ability to consciously recognize and understand your own emotions, thoughts, behaviors, and how they influence others. Before we communicate with patients or relatives, we must be aware of our own values and principles and how to translate them into our communication. Only based on our knowledge about our own values and beliefs, we can establish this personal ethical standard. Self-awareness is also your key component of emotional intelligence and personal development. The core elements are emotional awareness. You need to recognize your own emotional states and understand what triggers them. You need self-reflection. You need to think critically about your actions, decisions, and reactions. You need to understand impact. You must be aware of how your behavior affects others around you. You have to be open to feedback. You must be willing to listen to others' perspectives and use the feedback you get for growth. You need authenticity. You have to act in alignment with your values and principles. So, before communication with patients or relatives, you must be aware of all of this and how you can translate them into your communication. Based on that, you can establish your personal ethical standard. So, what are values? They are personal standards that give you in all aspects, that guide you in all aspects of your life. Your personal ethical standards should include the principles and values that you are using for making judgments and decisions, what is right, what is good, or virtuous. The ethical values are theory. They are your guiding principles. They are ideals and standards for navigating decisions and choices. The ethical values are your moral compass, guiding your behavior, actions, and communication. They are your personal standards that guide you in all aspects of your life and something you hold as important. Virtues, they are reality. They are your cultivated, grown, practiced, and mastered habits, and they include a variety of character strengths. The virtues are experienced and observed. You live and act upon your virtues. For example, your value may be that it is important to show humanity when working with patients. But if you have not experienced and practiced loving and being loved, if you have not practiced how to show empathy and kindness, then you will not be able to do what you think is valuable. So in palliative care, communication ethics is important. To make communication ethics a cultivated, grown, practiced, and mastered habit, you need to experience and observe your communication mindfully. You need to use your ethical imagination and be able to justify it ethically. In communication, we all express our ethical standards in many different ways. You apply your personal ethical values whenever you decide to express yourself verbally. Very often, you apply your personal values automatically and unconsciously. A tool to express ethical standards can be asking other people questions about their interests that will help you to develop your moral imagination and your personal interests. There are several approaches for evaluating a principle or value for its ethical qualities. To find out and reflect on the expression of your ethical values of communication, one of these approaches is logical analysis, encompassing consistency and coherence. So what's the difference then between consistency and coherence in ethical standards? If you apply your principle or value with consistency, it means that you apply it in similar ways in a wide variety of situations. In practice, this means that only through frequent assessment of physical, emotional, social, and spiritual needs of a patient, a nurse will be able to tailor the patient's care aligned with the patient's values and preferences. There are also two additional criteria for consistency. The first is reversibility. Ask yourself, what would be the consequences for someone else if I used or did not use the principle or value in a certain situation? For example, lying instead of telling the truth. In palliative care, reversibility highlights the importance of quality of life over simply prolonging it. The second criterion within consistency is universalizability. In practice, universalizability involves developing systems and approaches that ensure everyone the access to high quality, culturally respectful and comprehensive palliative care. You should try to reflect on what would happen if an ethical value or principle were applied to everyone in every situation. Consider whether you would apply it consistently or whether you would make exceptions because it would benefit your self-interest to do so. What do your personal ethical values say about that? The second criterion within the logical analysis approach is coherence. You have multiple values or principles. Coherence is about reflecting on how well your values and principles fit together or whether there are contradictions between them. In other words, you consider the relationships between your values and principles within your personal and moral standard. Is a certain moral value more important than another one? For example, how can you communicate in an honest, empathic, and supportive way at the same time? Let's see an example. This excerpt is what the nurse can tell the patient in a situation where she or he stays with the patient after the physician has told the patient that the patient's illness is incurable. The nurse tells, "I know this isn't easy to accept, but as the doctor said, it seems that we can't cure your illness. We can still focus on symptom management and improve your comfort. I'm here with you to make sure you get the best possible care for what matters most to you." Do you think there are contradictions between the values of empathy, honesty, and support? Is a certain of these moral values more important than another? Sometimes contradictions can lead to ethical dilemmas where it is difficult to decide what to say. If you want, you can write what you think in the chat. We can talk about it in the end. Think about your personal ethical commitments. Are you well prepared for interactional situations? If you prepare yourself, it will be much easier for you to discern your communication choices. Through well-considered communication, it's easier for you to put your ethical standards into practice. Think about which of your ethical values or principles are important in your interactions at work. Are you consistent in applying them, or do you do expectations? Is there coherence between your values? Do they fit together, or are there tensions between your values? Reflect on possible consequences and usefulness of how you evaluate your values and virtues in real life. You can also write about that in the chat. Within communication ethics, there are several skills that will help you in your encounters with patients and their relatives. In the busy world of today, it's easy to focus on concrete, everyday needs that are received and must be completed. However, as a nurse, you work with patients. You have psychological, social, and spiritual needs like all of us. A patient has a strong need to be listened to, seen, heard, understood, respected, and appreciated as a human being. All these needs must be met with a person-centered approach, no matter how busy you are. Then your communication becomes more effective. And effective communication between patients and healthcare providers has been found to be crucial to good palliative care. Therefore, it is important to consider and reflect how you can better meet the above mentioned needs to make your patients and relatives feel better. There are two essential skills that have a positive impact on well-being in the dialogue between you, the patient's relatives, and your colleagues. That is understanding and understanding each other. Understanding is meaning a clear dialogue. Understanding each other includes subordinate skills like fostering understanding by using an understandable language, fostering understanding by giving and receiving all information needed, and fostering understanding by real dialogue. As in all sectors, in palliative care settings, a specific vocabulary and language is used. In any interaction, it is of great importance to remember who you are talking to. Consider and adjust your language, its content and style to suit the palliative patient or the relatives when you are talking to them in a particular context or situation. That is called linguistic awareness. You can't talk in a medical language to an 80-year-old person with mid-stage dementia. You need to use a language where you keep her or his dignity and respect by talking to an adult. But don't use difficult medical terms. Everybody has a fundamental right to understand and to be understood, regardless of their language background. In your profession, you must provide linguistic accessibility in the dialogue, where both parties understand each other. To achieve linguistic accessibility, language awareness is of great help. Language awareness means being constantly and actively aware of the kind of language we use, considering, for example, context, situation, linguistic features, style, and vocabulary. In a language-aware organizational culture, linguistic diversity is recognized, and the importance of languages has been considered. The diverse dimensions of language awareness are recognition of different languages, flexibility in the use of different languages, and attention to attitudes towards speech communities. In your work, you should be aware of the impact of which language you use, and you should use your own language appropriately to every situation. So, according to this, language-aware thinking is an appreciative and understanding view of different languages and language styles. It also means that one's own linguistic choices need to be evaluated and revised according to the context and the situation. By working in a language-aware way, barriers to participation and understanding in the workplace can be removed. At the same time, it promotes the inclusion of persons who are learning the language of the working community. Everyone can consciously choose the level of difficulty, explain, use easy language or a language that everyone understands. Additionally, everyone can support a language learner in the workplace by taking actions that help them to learn. Opposite examples that create barriers could be discouraging inclusion, expecting everyone to adapt immediately to the dominant language with no patience for learners. It could be using jargon, technical terms, or insider slang without explanation, which excludes those who don't already know the terms. It could be ignoring language levels, always speaking or writing at a very advanced level without adjusting to the audience's needs. And it could be lack of explanation, giving instructions or important information without clarifying or checking understanding. It could also be no support for language learners, not allowing time for questions, corrections, or practice, assuming that learning the languages is the learner's sole responsibility, as it is not. So the aim of any communication situations is for all members to understand each other and to be understood. Good quality interpreting is the best way to support the accessibility, as linguistic accessibility is needed in conversations between patients and healthcare staff, and when there is no common language. The access must be given by liaison interpreting. Other skills and tools can be needed in other situations where there is no common language, or where the patient or his or her relatives has a speech impairment. The skills and tools can include sign-supported speech, pictures and objects, drawing, touching, simplified language, and bliss symbols. So, who benefits from linguistic accessibility? All participants in the conversation, of course. However, there are challenges. An example of a situation in which there is much need for linguistic accessibility is when one party uses the dominant language and the other party has linguistic challenges or is not a representative of the linguistic majority. That could consider a person whose mother tongue is not the dominant language of the country in which they live, a person who is learning the dominant language of the country, or a person who has challenges to express themselves through language. In our diverse world, we of course meet these persons everywhere, but don't forget they are more vulnerable in situations of palliative care. As a nurse, you must use your knowledge of linguistic accessibility and language awareness when giving and receiving all crucial information needed in communication with patients and relatives. The language should be clear and explicit. The feeling of uncertainty is unbearable for any patient or relative. The team you work with should also be aware of this. For the healthcare staff, receiving all relevant information about the patient can be life-saving. For all, understand what you are saying is also facilitated by you using explicit and clear language. If we really want to understand each other, we need to send and receive signals that we can trust each other in real dialogue. Trust creates a sense of safety. When we trust someone, we feel that we can rely on them. This feeling makes us relax and feel safe. And there are several ways to foster feelings of trust and safety. Honest and openness combined with friendliness will support the feeling of trust in you. The patient will feel safe if you tell them the truth. It is often difficult to find the balance between being truthful and sensitive, especially in situations where negative information needs to be given. Then it is important that the people you are communicating with feel that they are on the same level. Make sure that your patient or their relatives feel equal, not inferior or less worthy. There are several ways to promote this sense of equality. By building trust and being open, you will foster understanding and well-being. Real, genuine dialogue is fostered by real, genuine interest, appreciation, dignity, and respect. The fact is that every person you communicate with values trust and the feeling of being safe. You can foster these feelings by focusing on truthfulness, empathy, and friendliness, respect, appreciation, and dignity. Building trust through communication is enabled by telling the truth in an appreciative, respectful, and non-abusive way. If your patient, the patient's relatives, or your colleagues trust you, they will rely on the accuracy and reliability of what you tell them. However, truthfulness is difficult. It is not possible to know the whole truth. Therefore, we must understand what people who intend to tell the truth are speaking honestly according to how they understand the truth and according to that what they believe the truth is to be. That kind of communication, based on the presumption that the communicators are honest, is called the principle of veracity. I have an example. The patient, a 70-year-old woman, is facing severe symptoms and a poor prognosis. Her family, upon being informed about her condition, has asked the palliative care team to withhold this information from her, fearing it may cause undue distress. However, the principle of veracity requires palliative care professionals to be truthful and transparent about the patient's diagnosis and prognosis. The principle of veracity underscores the patient's right to know the truth about her health, enabling her to make informed decisions regarding her own care. According to your values, what is right? Should she be told about her bad diagnosis according to the principle of veracity? Or should you think the family has the right that she should not be told about her diagnosis? You can write comments in the chat. Everyone appreciates friendliness, patients, relatives, colleagues, and superiors. When you use the skill of friendliness at work, you will experience well-being for your own and a positive working climate. Such a small thing as positive body language is important. So If you express kindness and friendliness, you will receive a positive response from those around you. As a nurse, it is crucial to try to see things from the perspective of patients or relatives. We call it empathy. If you work empathically, you can remain in a state to help and support rather than being overwhelmed by your own feelings towards them and their problems. Empathy can be explained as put yourself in the patient's shoes, but keep your socks on. Other important empathic skills is to sometimes remain silent. You know, you've got 2 ears and 1 mouth. Think about it and be focused in listening. Be willing to attend and see thoughts, beliefs, and feelings from the speaker's perspective. You don't need to have a solution on everything. Sometimes just listening is the solution, the most important part. Storytelling has been shown to be a relief for patients or relatives. And in communication, it is important that you can distinguish between empathy, sympathy, pity, and patronizing. As I said earlier, an empathic nurse identifies with the patient while still maintaining a distance. Think of it as it sounds like you're feeling scared about what's happening. I'm here to listen. Empathy is what you should use in your work. However, empathy in communication is not without challenges. You risk falling into different traps. A nurse who responds with sympathy is one who experiences feelings as if he or she is the patient or relative. In other words, sympathy is shared suffering. Think of it as it's really sad to see you in this situation. Remember to protect yourself from over-identification with the situation of the patient or their relatives. If you over-identificate, it will affect you negatively on your well-being. Pity should be avoided because of its condescending, disrespectful, and rejective nature. Think of pity as it's just so tragic what you are facing. The patients don't feel relieved if you pity them. And patronizing someone should be avoided. For example, saying to a relative, I know exactly how you feel after the patient has died is selfish and simply not true, because the death will have a unique effect on each person. In many cases, it's wiser to communicate empathy non-verbally or verbally through reflection. For example, in the case above, you could say, I can see how sad you are, and put your arms around the person. As a nurse, you should show respect and appreciation by taking time for conversation. You may have lot of work and feel that you are rushing from place to place. However, your patients and their relatives will feel much better if you are available for a small talk, just for a small while. These confidential conversations give you much information in a natural way. You don't become an interrogator. You and the patient or relative become parts at the same level. To communicate well includes listening skills, focusing and concentrating on the conversation. Genuine presence, showing interest by asking questions, and being approachable and noticing the other persons. You also show respect by remembering consent and confidentiality. A dignity-preserving communication style is one that ensures that no one involved in the conversation loses their face. A person loses face when someone or something provokes shame, vulnerability, fear, or negative emotions. You can cause your patient to lose face by giving negative feedback, both in public or in private. Negative feedback can be treating them like a baby, or as if they are ignorant or will lack insight. Think about yourself. Were you clear in your earlier conversation? Did the patient or relative understand what you meant? Is that the reason why they don't seem to understand you? Here is an example of keeping respect, appreciation, and dignity in a nursing situation. An elderly woman with advanced cancer experiences pain and anxiety about her prognosis. The nurse shows respect for the patient's autonomy and acknowledges her right to make decisions about her care by saying, "I want to make sure we discuss your care preferences. What matters most to you at this stage?" And the lady gets an opportunity to tell. When the nurse conveys appreciation for the patient's willingness to share her thoughts and emotions, she would say, "I really appreciate how open you've been about your feelings. It helps us provide the best care possible." Moreover, dignity can be indicated by saying, "I understand this is a challenging time for you. I will ensure you are comfortable and that your privacy is respected during any procedures." Sometimes verbal communication methods are not enough. Then effective communication tools are essential for palliative patients with speech impairments, so they can express their needs and preferences too. Augmentative and alternative communication devices, called AAC devices, help those palliative patients who have severe communication impairments to express themselves when speech is no longer positive due to their illness. These devices improve patients' quality of life by enabling them to communicate their needs, preferences, and emotions, thus enhancing their autonomy and dignity. Tools should be designed individually. Speech therapists or other specialists should be involved in planning the best suitable methods. Check who is your best collaborative partner where you work. Methods are derived in non-technical, low technical, and high technical methods. Non-technical methods has no outside technique. You communicate, including body language with facial expressions, gestures, nodding, and vocalizations to express yes or no or I don't know. Low technical methods include paper and pen, alphabet boards, and individualized pictures and symbols. The pictures can, for example, include best possible bed posture, painkillers, or important food. High technical methods are devices such as speech amplifiers, speech devices, also called communicators, eye-tracking communicators, head mice, and environmental control devices. These different types of methods enable handy communication and connection with family and the community. If a patient is suffering from an illness that affects communication in the future, it would be beneficial to record the patient's voice in advance. In this way, the patient can still communicate using his or her own voice and be proactive. Begin introducing tools early in the illness if it is known verbal communication will deteriorate. Then both the patient, relatives, and healthcare professionals are familiar with the tools. So, in conclusion, remember that the core of your own ethical standards in the care relationship is communication. Good communication is needed between you and the patient, you and the relatives, and you and your other healthcare professionals. From your perspective, this requires calmness, patience, and empathy to give the patient the sense that you are truly present and listening. And by that, I thank you for listening. I hope we find some questions in the chat.
Yes, I just checking. I think you will hear my voice even if I sit here. Can you confirm?
Yes, that's fine.
Yeah, okay. So we have here in the chat, we have comments on your questions. So if we start with Adam, Adam says here that it was the story you were telling about communication. So he says that he would ask what and how much the lady wants to know and what is her perceptions of the situation where she was, and that could guide the discussions.
Yes, of course you should listen to the patient. I'm struggling with my mouse. So
we have had a nice game here. The name is Find Your Mouse, because we have two screens and we always lose the mouse between the screens. And then Mina-Lisa here is saying that, in my opinion, patients should know their diagnosis so that they can make decisions about their treatment and end-of-life care. I agree with Adam that the information provided during the discussion should be tailored to how much the patient wants to know and at what pace the matter is discussed.
Yes, and I totally agree with that. The importance for in my point of view, is that the patient is informed as much as she wants to know. It should not be the relatives who are deciding how much the patient should know about herself.
Yeah. Then I think we have a very nice comment here from, oh, I'm sorry, I don't know how to pronounce your name, Steen. As a nurse, I am also human. So she's speaking about the feelings of ourselves. In the care relationship, I sometimes experience empathy, sometimes sympathy, and even pity. This is not wrong. It shows that I'm touched by the suffering of others, but it is my professional responsibility to recognize those feelings, to name them, and not to get carried away by them. Empathy requires closeness while maintaining clarity. Pity and sympathy can be comforting, but they must not undermine the patient's autonomy. It is precisely the act of distinguish between them, however difficult, that makes our profession so special and so vulnerable. It was a very tricky word. I'm sorry.
Yes, and I agree. However, you must take care of yourself, so you don't begin with a sympathy and then you get lost in your own feelings, taking care of the patients. So that is why I'm talking so much about having empathy to protect yourselves too in this situation.
And then we have a question for you. Thank you for the insightful talk, Ulla. In your experience, how could we reflect and guide ourselves in differentiating between empathy, sympathy, and pity, reflecting from the individual aspect and looking at the ways to grow together as a team?
I think conversations in the team is a very good way to have reflections for all healthcare staff working in the same place and lifting one patient occasion, for example, and talk about what happened and why things happened and what can be done to these things. And in that way, you get all others' experiences, and you can build a good reflection in the team, and then you take that with you.
Yeah, that's good. And I really like what you are speaking about dialogue, because of course we are, or when we are speaking and communicating, we are mirrors.
Yes.
So what you are saying about speaking in the team, we are also learning and getting more aware of ourselves.
Yes, of course.
Yes. And then we have a comment that thank you so much for the wonderful presentation, which I really agree with. It is really helpful for delivering quality patient care.
Thank you.
Then Neil have put a comment here. Thank you for the well-presented topic. One of the hardest part in communication is language barriers. It is sometimes hard to empathize clearly if the patient and care provider speak different languages. At most we can say is, I am so sorry.
It is really different with these language barriers. And I see it from my perspective in Sweden. We have more and more new Swedes, we call them, working in care, in caretaking as healthcare personnel. And the healthcare professionals don't understand the patients, and the patients don't understand the healthcare professionals. And that creates really different meetings. And the patients sometimes and all the relatives say that we don't want those people coming to help us because we don't understand them. So we have to be aware of this and try to work with ourselves, with our colleagues, and help each other to be better in communication, to make a better care for the patients and relatives.
Yes. Then there are no more comments.
Mm-hmm.
I just will give some time if there will come more comments. And I have just one question for you. So you were speaking about the values. So what do you yourself think is the most important value in communication?
I think it's telling the truth. But in what we were talking about earlier, you should not provide the patient with the whole truth just like that. You have to think about what you're saying, but never lie.
Yeah, and I think this is like very Scandinavian, I would say, like Swedish thing, and also to realize and understand that the values can be different in different cultures. It's in my mind very, very interesting. So that's I wanted to check. Are you just like me? And you there?
We are the same.
Okay, but now there are no more questions. There are comments that thanks for you, and I really also want to thank you. It was a pleasure to listen to you, and it was nice to be here in the same room in the north of Finland. And now I will head to Brussels and get Patricia on screen. So the floor is yours, Patricia.
Thank you, Mina. And as you can see, the sun is now shining in Brussels, thankfully. Thank you so much, Ulla, for that presentation. It was really thought-provoking and really, really interesting. And I think it's given us a lot to think about. And thank you for your wisdom in that presentation.
Thank you.
All that's left then is for me to say that we have one more webinar in this series. It is in 2 weeks' time. And again, if you want to follow us on our LinkedIn account and on our website, you'll find details about that. I'm also just posting about the EAPC Congress. You are very welcome to submit an abstract for that. And also, if you wish to become a reviewer, you can see that there's details for that as well. You're very welcome to find out more about that. The last thing really then is for me to thank Mina, to thank Ulla, but most importantly to thank all of you for attending, because these webinars wouldn't happen without you being here. As you know, they're being recorded and they will be available for you, and the presentation will also be available along with all of the other resources that we're developing at the NursEduPal IMPACT project. Here's the link for the certificate of attendance, and again we would like you to fill out the evaluation form, and that means that we have an idea of how you're feeling about the webinars. So all of the information is there. I will leave this up for a minute, and I'll also just put it into the chat so that you have the link then for the evaluation form and the certificate of attendance. I look forward to seeing you again in 2 weeks' time for our final webinar in the series on moral and ethical leadership. Thank you very much.